Today's topic will be bloodborne pathogen training, preventing disease transmission. The objectives of this presentation are to describe how infections occur, identify how bloodborne pathogens are spread, identify tasks that have potential for exposure to infectious materials, recognize the importance of hand washing and personal hygiene to reducing risk, recognize the importance of personal protective equipment, and describes procedures for exposure incidents. In 1991, OSHA, or the Occupational Safety and Health Administration, issued standards to protect employees by reducing or removing the hazards of bloodborne pathogens in the workplace. And it applies to all who have potential for exposure. Pretty much every employer has to abide by these standards and has bloodborne pathogen policies and procedures. But it's basically there to provide safeguards for worker and workers from each other. So some definitions before we get started. A pathogen is any virus or microorganism or other substance that causes disease. It's basically an infecting agent. So it could be a virus, could be bacteria as well. A bloodborne pathogen is found in the blood or certain blood products. And then the way we typically try to prevent the exposure to these bloodborne pathogens is to treat everything, whether it's blood or other bodily fluids, as if they were known to be infected by some bloodborne pathogen. Sometimes these are also called standard precautions, but predominantly universal precautions. These are some types of potentially infectious material. Most people know blood's saliva and dentistry because it has access to blood, or there's blood in it. Semen and vaginal secretions. This one's important because we talked about with head injuries that cerebrospinal fluid coming out of the ears and nose, so that is a potentially infectious material. Unpreserved human tissues and bodily fluids. These things here are not infectious unless they are contaminated with blood, like feces, saliva, urine. For instance, if somebody has a kidney stone and is passing blood within their urine, that urine is now potentially infectious material because it has blood within it. There's several different ways bloodborne pathogens can be transmitted to somebody. One is through either direct contact, where the infectious blood comes in contact with someone else's blood. This can be open cuts, so someone has a cut and it's bleeding and you have an open cut, their blood gets into your cut and you could be exposed or contaminated as a result. Nicks abrasions, also vector-borne, so if a needle stick, that's considered a direct contact. So if you're stuck with an infected needle, that is a risk of exposure. You can also get it through indirect contact, contacting contaminated objects or surface and transmitting infectious material to your mouth, eyes, nose, or open skin. Common one is using gloves. Everyone wants to use gloves, but then they're touching everything and then they touch your face. Those gloves are contaminated, so those gloves should be removed before and hands washed before you touch your face. And then droplet transmission, where there's airborne transmission that is taken in through the nose or mouth, and that could expose a person to some kind of pathogen. There are certain conditions that are necessary for disease transmission. There really is four. You have to have a pathogen present. There has to be enough of the pathogen present to cause the disease. The pathogen has to pass through the correct entry site, which is eyes, nose, cuts, needle sticks, or mouth. And then finally, the person has to be susceptible to the pathogen. Once, for instance, if we build up immunity to a pathogen, we're no longer susceptible to it. However, if we haven't built up an immunity to a pathogen, we are then susceptible if we are contaminated through one of the entry sites listed. So we do a lot of things to try and prevent exposures. One is we use sharps disposable containers. These things are known as engineering controls. Sharps containers are for needles, syringes, scalpels, things of that nature. Clothing does not go in these. Band-aids do not go in these. You can have self-sheathing needles. Biohazard bags are important. With biohazard bags, like for instance, again, Band-aids don't necessarily go in there, but anything soiled And soil is defined as anything, if you were to take it, put it in your hand, squeeze it, and it would come through your fingers. That's considered soil. And then personal protective equipment, as you can see on the bottom left here, face masks, eye shields, which she doesn't have, but gowns, gloves, even hairnets are all considered personal protective equipment. As far as workplace controls, these are things you can do. Place sharp items in elite proof, puncture proof. These are the biohazard containers. As again, basically, they must be used at the point of use, which means you take the sharps container over to the person or whoever's using the needle. You do not take the needle across the room to the sharps container, because that is a risk of exposing somebody if they walk into you and you stick them. You want to avoid splashing, spraying, or splattering blood materials. So if you have blood material on the surface, you don't want to go out there and just vigorously spray the bloodborne path of blood. Because it could splatter everything everywhere, and that is a risk of exposing someone else. Again, dispose of any soiled clothing. As far as soiled clothing, if you get blood on yourself, gloves, they all go in a biohazard bag. They do not go in the sharps container. They go in the biohazard bag that you see on the left. As far as athletes, anything that is soiled must go in a biohazard bag. So for instance, if you have a little spot of blood, that uniform still has to come off, but it doesn't have to go in a biohazard bag. That can be taken home, washed, and be taken care of. However, if the uniform is soiled, again, where you can, if you were to squeeze it and the blood could seep through your fingers, then what you're going to do is you're going to place that in a biohazard bag, and that uniform is no longer able to be used. Again, you want to clean and disinfect all equipment and work surfaces after each person. Now, in a mass casualty event, that may not be possible, but if you're in a facility where there's potential for exposure, you want to clean each surface between each person. And really what you're going to use is 1 part bleach to 10 parts water. And this has been approved by the EPA, and bleach basically kills everything. You want to wash your hands thoroughly, and I put this picture up to show you how to wash your hands. It's not just a matter of putting soap in and rubbing your hands together. You want to rub your hands together, get in between your fingers, your thumb, wash underneath your nails for a minimum, and this is key, minimum of 20 seconds. You can use alcohol-based rubs. Don't use just antibacterial, because that doesn't really kill anything but bacteria. You want those alcohol-based rubs. I think it's 60 to 70% alcohol-based rubs will kill pretty much everything. And finally, don't eat or drink, smoke, or apply cosmetics, or handle contact lenses. Basically, don't touch your mouth, nose, or eyes in an area where you have the potential to be exposed to infectious materials. Now, in the unlikely event you are exposed, every employer has an exposure control plan, and this is designed to basically lay out the policies and procedures if someone is exposed to a bloodborne pathogen. The plan should include exposure determination of what does an exposure mean, or what is it what entails an exposure. Methods for implementing other parts of the OSHA standard, and procedures for evaluating details after an incident occurs. So again, exposure incidents by OSHA defines any incident where as a specific eye, mouth, or mucous membrane, non-intact skin, or needle stick contact with blood or other potentially infectious materials that results from performance of an employee's duty. So basically, if you get something in your eye, blood or other potentially infectious material in your eye, that's classified as an exposure, and you would activate the exposure control plan. Immediately after you feel you've been exposed, wash any needle sticks with soap and water. Flush your eyes, nose, mouth, and skin with water. Irrigate your eyes with clean water or saline if you got something in your eye. And the key is to report it. Don't try to hide it. Make sure you report it so that you can follow the appropriate steps within the control plan. And the employer is in charge of making sure you get the medical attention that you need to follow up with these exposures. So the best way to prevent getting a bloodborne pathogen is to avoid contact with blood or bodily fluids. That's the best way to prevent. Don't come in contact. Use breathing barriers, use your PPEs, remove jewelry, obviously when wearing gloves so that they don't cut them. Cover cuts, scrapes, and sores if you have them and you know you're going to be working with people that may have cuts. Do not use torn gloves. Like I said, do not reuse gloves. Once you use gloves on one person, before you go to the next person, you should, or you must, change those gloves out so that you don't expose that person to a bloodborne pathogen. Avoid using items such as pens, radios, or combs when wearing soiled gloves because you could leave contaminants behind and expose someone else. Wear other protective clothing. So again, like I said, although we're not doing a first aid kit, I recommend you have one, and then if you don't wear glasses, that you have safety goggles in your first aid kits to protect your eyes. And then remove gloves correctly and dispose with them within a biohazard bag. Another prevention for specifically hepatitis B is vaccines. This is a 3-shot series. Typically you get one, you wait approximately 2 to 4 weeks to get the second one, and then you wait between the first and the third shot or immunization should be 4 months. So it's a 4-month procedure, but it's very important to get if you know you're going to be exposed or have the potential to be exposed to a bloodborne pathogen. And this is you get this at no cost. Your employer will pick up the cost for this immunization series. Highly recommended if you're going to be in any situation where you have the high likelihood to be exposed to blood. Like for me, I've had this immunization because I work in an athletic training clinic many times, and there's a lot of potential for exposure to bloodborne pathogens. Here's the Red Cross video.
As a lifeguard, you need to follow standard precautions to protect yourself while providing care. At times, you may come in contact with blood and other potentially infectious material such as other body fluids that may contain blood-borne pathogens. Blood-borne pathogens can cause disease. Hepatitis B, hepatitis C, and HIV are 3 diseases that are passed through body fluids that are of primary concern for lifeguards. Anyone's blood or body fluids might carry disease-causing germs. Someone you know well, or even someone who shows no obvious signs or symptoms, could be infected. Following standard precautions, you should treat all blood and body fluids as potentially infectious material. By following standard precautions, you can minimize the spread of infection while providing emergency care. Standard precautions include the use of personal protective equipment, good hand hygiene, engineering controls, work practice controls and proper equipment cleaning, and spill cleanup procedures. When exposure to any potential infectious material might occur, it's important to use personal protective equipment. Personal protective equipment includes nitrile latex-free disposable gloves, breathing barriers, protective eyewear, and any other specialized protective clothing that will keep you from directly contacting infected materials. Wear nitrile latex-free disposable gloves when providing care. In addition to disposable gloves, wear protective coverings such as a mask, eyewear, and gown when there is a likelihood of contacting blood or other potentially infectious material that may splash. When giving ventilations to a victim, use a CPR breathing barrier or bag valve mask resuscitator. After providing care, follow proper procedures to dispose of soiled equipment and clean up any blood or potentially infectious material that may have contaminated the area. Take the same precautions in disposal and cleanup as you do when treating the victim. Anytime you might come in contact with body fluids, you need to take deliberate action to prevent the spread of infectious disease. A blood spill kit should be available to safely clean up blood. Follow the procedures outlined in your facility's exposure control plan. When removing gloves, be careful not to touch your bare skin to the outside of either glove. First, pinch the palm side of one glove near the wrist and pull the glove off so that it is inside out. Holding the glove in the palm of your gloved hand, slip 2 fingers under the wrist of the glove, pull the glove off inside out so that the first glove you removed is inside it. Dispose your soiled gloves in a biohazard bag and wash your hands. Proper hand washing is the most effective method of preventing the spread of infection. To properly wash your hands, Thoroughly scrub them with soap and warm water for at least 15 seconds, giving added attention to fingernails and jewelry. Standard precautions are simple to remember. Always use personal protective equipment when caring for a victim or cleaning up a scene when any body fluid is involved. Properly dispose of your personal protective equipment and follow proper procedures to clean up after providing care. If you don't protect yourself on the job, you can't protect the people that count on you.
Okay, one thing with this video, I know they said that washing your hands is the #1 way to prevent contamination. That isn't really, I don't agree with that. The #1 way to prevent contamination is to avoid coming in contact. Once you have the gloves on, you've already come in contact. So secondarily to avoiding contact is washing your hands. So just to wrap up, here's a nice little chart that I found. Basically, to protect yourselves, know your rules. There's different colors. The red bags are where you put your bloodborne pathogen materials into. Wear your different PPEs. Wash your hands correctly and thoroughly. Dispose of any things. Remember, with sharps containers, they go to the point of use. You do not walk the syringe or any other sharp material across the room. And then follow your proper disposal procedures when it comes to getting rid of the biohazard materials. And that's it for today. Have a good day.